Welcome to the Mayo Clinic Ophthalmology Podcast, brought to you by Mayo Clinic. I'm your co-host, Dr. Brittany Scruggs.
And I'm your co-host, Dr. Eric Bothan. We are here to bring you the latest and greatest in ophthalmology, medicine, and more.
Today, we welcome back our Mayo Clinic glaucoma colleague, Dr. Cheryl Khanna, for a Glaucoma Journal Club and discussion about disinfecting tonometer tips and sustainability. Welcome, Dr. Khanna.
Thank you. It's great to be here.
It's wonderful to have you back.
Thank you.
You know, so many of our listeners know that you are an outstanding glaucoma specialist, and we value you as our colleague for managing patients in that arena. But what many people don't realize, unless you've been in our department, is you've been an incredible leader for our clinical practice over the last 6 years. And in that, the patient outcomes, patient experience topics and efforts you helped lead, along with efficiency, waste, and sustainability. And so I just want to say thank you on behalf of our department for all of those, which brings us to this journal club. Because we were looking for topics, and you had suggested this critical topic that you've been involved with, sustainability and waste, and how it's gotten really national reputation and importance to address that within ophthalmology. Can you share with us, given your unique role in leadership and in research, kind of what are the biggest areas in ophthalmology across the country that are getting attention for waste and sustainability in our practices?
Well, it's been a great journey over the last 6 years as clinical practice chair and also working with American Glaucoma Society as the patient care committee chair. And it's given me an opportunity to look at some of the opportunities for sustainability, reducing waste, but also optimizing patient safety. And so we've looked at a number of different processes and protocols that we have at Mayo Clinic across the enterprise, but also nationwide. An example of that might be our multi-use eye drop bottles. So we used to throw them out at Mayo Clinic every 30 days. And we went through a 2-year journey to change that. And now we use each eye drop bottle that's multi-use until the expiration date on the bottle. And that may not sound like a big change, but actually these little changes that impact daily clinic flow and reduce waste are very, very helpful to the practice.
And how long is that normally, the expiration date? So it's longer than 30 days?
It varies by drug, and so we looked at all the drugs that we use on the clinic floor. And so it depends upon, whether it's a refrigerated drop or not, but most of them are, a year, even a year and a half. Not all of them are that long.
But that's a big difference.
Yeah.
But it's a huge difference.
Just throwing out drops. Yeah,
and we have such a large volume in our clinic practice, but typically we would use the bottle up before the expiration date anyways, but sometimes it would be beyond 30 days. So.
Yeah. So with your experience as clinical practice chair for 6 years, by the way, what a hard job and I respect you so much. It was really wonderful to partner with you, and you did so much for our practice. But with that role in clinical and hospital leadership, what was hard about it? Like what were some of the roadblocks, the hindrances to really turn the dial on sustainability and actually make clinical practice changes?
Yeah, I think, first of all, it should be very difficult because we want these changes to be very thoughtful, very deliberate, based in science. So I'll start with saying that there's a lot of care taken before any change is even considered. I think that, part of making real change that is based in science is to really talk to all the teams and all the stakeholders involved. So we need to talk with everyone from the patients to the nursing staff to pharmacy to our technical staff. And I think then you really get a perspective all the way around the table on how to make these initiatives successful.
I know a number of other areas that you've been involved with in terms of drape size. We're going to talk about reusable lenses, whether tonometer tips or laser lenses, things that come close to the eye. But do you have advice, given your expertise and how you move the dial with our multi-use drops in clinic, for physicians and even administrators when they're wanting to bring their practice to a new level of sustainability or waste priority? there's a lot of barriers. There's a lot of effort. I mean, you said it took 2 years to change our drop practice.
Right.
What advice do you have for physicians out there wanting their practice to become more sustainable and knowing how hard that journey is?
I think, first of all, it's being open to change. And I think it's talking to a lot of different people, a lot of different groups, and thinking about the things that you do every single day, all the patterns that we fall into that are good and bad. And then I talk to people like, we have our own waste management and Mayo Clinic, and they're an incredible group. So the recycling that they do, they vet how the recycling is used. They do an extremely thorough job. So I actually had waste management from Mayo Clinic come in and say, how do we improve the clinics? How do we recycle more? How do we reduce waste? We talked to the nurses in the operating room and said, there are some instruments that we never use on our tray, but we're cleaning them constantly. How do we make individual surgeon packs to reduce that waste? There's so many eye drops before and after surgery. How do we, reduce waste for the individual patient, but as well as all of our patients as a community? So I think there's just a lot of opportunities on a day-to-day basis, and overcoming those barriers means understanding the core issues and the sort of the mountains that you have to climb. What are the core issues? For the multiple use eye drop bottles, we had some pharmacy rules, so I met with my pharmacy colleagues. Really, the FDA, the CDC, Joint Commission, Association of Nursing had all really accepted the fact that we can use multi-use eye drop bottles until expiration date. But Mayo was kind of late to the table to change, but I didn't know that. So I did a lot of research looking at where the barriers were, and then you seek out your colleagues that are leaders in that area and say, are you open to change? Can we have some conversation? And what would it take to make a change here? I think another thing that we do a lot here at Mayo Clinic is simply do pilots. And so you can do things on a small scale to see how does that work. There's always going to be hiccups, there's always going to be some controversy, but I think if you're patient and persistent, you can really overcome those barriers.
And one of the protocols you implemented was the reusable ophthalmic laser lenses, and we know that lasers are super common, right? More than a third of patients need a YAG after cataract surgery at the 9-year period. I think that came straight from your paper, 38%, right?
Right.
So it's a lot of people needing these lasers, and SLT is a really common laser that's performed by glaucoma specialists. And so you recently published a paper, so I think we should transition a little bit to talk about these laser lenses. The paper that you published was in Clinical Ophthalmology, and it was over the entire enterprise with some of your colleagues, including Dr. Darby Miller. And this was all about the incidence of conjunctivitis and keratitis, specifically with reusable ophthalmic laser lenses. So as a co-author, can you share why this was started? What was the impetus for starting this study?
Absolutely. So Dr. Miller did a great job. Actually, Eric as quality chair, and he was an absolute phenomenal colleague to work with over a decade, leading quality at Mayo Clinic in our department. So Eric and I and Darby would meet periodically and talk about different initiatives that we could do in sustainability. And so once we met and Darby said, Joint Commission told us that we weren't following high-level disinfection for lenses and tonometry tips. And he was a little bit upset about that because he said, we've been wiping our ophthalmic lenses and our tonometry tips for a long time using alcohol wipes, and we didn't see any outbreak of infections, and we think that it's really a safe practice. But the Joint Commission, certainly the CDC and the American Academy of Ophthalmology stated that high-level disinfection was important for the lenses and for tonometry tips. So to make a long story short, Darby decided to do a study looking at prior to making the change to disposable ophthalmic lenses and tonometry tips, looking at the incidence of conjunctivitis. And in 2,000 cases before that change was implemented at their site at Mayo Jacksonville, they had 0 cases of infectious keratoconjunctivitis. using alcohol wipes to disinfect ophthalmic lenses. So I think, Mayo Jacksonville is not the only site, certainly that use alcohol wipes. I know before we went to disposable tonometry tips, we were doing the same thing and really did not experience infectious outbreaks. So I think that's a really important addition to the literature. And other groups have also reported really the absence of infectious outbreaks using simply, cleaning followed by alcohol wipes.
You comment on the different levels of disinfecting that a different instrument used in healthcare might need to undergo to be seen as safe in the clinical practice. Much of those guidelines haven't been really, in my understanding, and based on your work and reading your article, weren't studied regarding the cornea and the eye surface. It's very different than other mucous membranes that might be, a colonoscopy or a bronchoscopy in that regard. Can you share with our listeners, just when you say high-level disinfectant,
right,
what does that mean, and how does that fit under the classification for what needs to be cleaned and how?
Yeah, it's actually a very complex topic. So there's something called the Spaulding classification that was really created in the 1950s. And that divides reusable medical instruments into 3 categories: critical, semi-critical, and non-critical. And each category requires different disinfection or sterilization. So critical would mean it's used in a sterilized situation, a sterilized environment, and it would require sterilization for a critical instrument. Semi-critical really goes back to, just as you alluded to, GI, respiratory, GU tract. So mucous membranes within a cavity. And those require high-level disinfection. And then you have non-critical items that do not contact mucous membranes, and they require low-level disinfection. And there's different chemicals that can be used for low-level or high-level disinfection. We can get into that a little bit more. But when the Spaulding criteria was devised, it was never applicable to the ocular surface, which has its own antimicrobial environment. And as we've studied the tear film, and we know that there's a lot of proteins that are synergistic and really allow for an antimicrobial effect. That's very important to be considered when we talk about tonometry and also ophthalmic lenses.
Yeah. So as a backdrop to understanding that cleaning these laser lenses appropriately is, we all value that in terms of risk. Absolutely. For our patients when we have so many happening. And so the paper that was produced, Dr. Darby looked at these 2,000 patients, and as you articulated, nobody was felt to have an infectious keratitis or conjunctivitis after their laser at the Mayo Clinic. Can you comment too then, in that paper, I thought it was interesting, they also looked at sort of cost and also waste. Yeah. And it's not just trying to protect patients, it's also valuing the cost and the waste aspects of it. But comment about, as you reflect on those aspects of the paper, the value that is to understand for practices.
I think when we look at disinfection, there's multiple categories that we can look at. One is patient safety, and we should always say that first. So what is safe for the patient? And I think some of the, the disposable lenses, the quality was not as good. And so we were using higher energy for SLT lasers with disposable lenses. And so that's one thing to keep in mind. Sometimes high-level disinfection, results in corneal burns because it's bleach, right? And so that can degrade the tonometer tip. You can have burns from the bleach. So I think it's a patient safety concern as well as a sustainability issue, and that's really important to remember. So
not only are you think you're doing something wonderful for the patient, saying we'll get a new one every time.
Right.
You have waste, but in these other types of sterilizations that were felt high level disinfectant, had these other complications or damage to instruments. I found that fascinating. So, resorting back to what's always worked was seen as so valuable, and was in this article was proven successful in patient safety.
Practical question. So for those who are listening and they want to know exactly how we are now cleaning these reusable lenses, so going from what do you use for the alcohol, how long do you do the soap and water, what do you dry with, what is the the logistics surrounding what you would recommend?
So currently, according to the manufacturing recommendations, according to the CDC, according to the American Academy of Ophthalmology, and I'll just refer to tonometer tips right now, it's dilute bleach, so a 1 to 10 concentration or 10% bleach, and that's for 5 minutes, and that's preceded by cleaning of the lens. So just simply scrubbing the lens or a tonometer tip actually has cleaning properties, as you would expect. It's like cleaning your countertop in the kitchen. It has some benefit. And then soaking in bleach for 5 minutes, followed by drying by air. And so that would be the protocol that would be recommended currently. And that follows a lot of different instructions, whether you're talking about the Joint Commission, the manufacturing recommendations, AAO recommendations, CDC. So right now there's a lot of layers of recommendation in terms of how we disinfect our tonometer tips and ophthalmic lenses.
So on the topic of layers and all of these organizations all bonding around the best care of patients and promoting the successful practices we all seek. You mentioned AAO, American Glaucoma Society, a number of institutions that seek a common goal. Mm-hmm. You've taken, as we maybe transition from that manuscript highlighting the success of reusable lenses, you've then looked at what voice these organizations can have in developing sustainable practices for tonometer tips. And so when we measure intraocular pressure, you touch a patient's tear film and measure their pressure, and then you have to move on to the next case and the scenario, and they get clean, whether it's a Perkins or historically a Shields tonometer, and now we have different measurement techniques. Can you remind people, again, in common glaucoma practice, measuring pressure, what are the most common ways they're being utilized, whether it's eye care or TonoPen, or can you just remind us what's happening in practices currently?
So there's a number of options, and everyone does their best to follow the criteria that were set up by the CDC and the American Academy of Ophthalmology. And so currently we use a lot of disposable products, okay, because we know that using bleach, even dilute bleach, really degrades the tonometer tip. We have that risk of corneal burns. So we're using a lot of disposable products. We do use eye care as well. We do use TonoPens as well, but those have disposable tips. Yeah. So in our practice, it's really all gone to disposable, which is an incredible amount of waste. I think in other practices, large academic practices like Boston University, Park did a really nice study in 2020. About $75,000 a year is spent just with disposable lenses and tonometer tips. So it's really a high price tag, and that holds true for Mayo Clinic as well when we looked at the cost of all these disposable products.
So I know we've switched a little bit to tonometer tips, but just to go back to the study we were mentioning regarding the ophthalmic laser lenses, we talked that patient safety is obviously number one. But number 2 and 3 is cost and then medical waste. We want to be mindful of those things as well. So for those people who are listening, they need to build this argument for their practice of we would like to switch to reusable lenses. We want to get away from disposable. How many procedures would make it cost effective, and what percentage of medical waste is actually decreased by doing that switch?
Yeah, I mean, it would only take about 100 cases to really see a cost savings and a reduction of waste by about 35–40%. So it's a huge amount of waste. If you look at an academic practice per year, it's about 200 pounds of plastic waste. So it's a huge amount of waste that's reduced if you switch to reusable lenses.
So why do you think a lot of academic centers are still using those disposable lenses, knowing the risk to the patient, but also all of these costs and waste issues?
It's a balance. So I think for the high-level disinfection that's required now, it's too cumbersome. There's a patient safety risk. And I think it's just not practical. The instruments are falling apart because the glue comes apart when you expose it to bleach. So it's not really practical for high-level disinfection, and that's why a lot of practices have went to disposable instruments, tonometer tips and ophthalmic lenses.
But over the multiple years that you did the laser lenses and the way that you were disinfecting it with the alcohol and soap and water, none of those needed to be replaced, correct? The lenses themselves were
correct.
They weren't damaged.
Correct.
Okay.
Yeah.
And I think that's important to remember.
Definitely.
Yeah.
Yeah. So as we talked about the second article, you shared with us this article that's pending, or a policy statement that you've had a valuable role in shepherding with a number of your colleagues around the country. But share with us what's coming as a possibility, as a policy statement from the American Glaucoma Society and the AAO, the American Academy of Ophthalmology.
So I'm really excited about this position statement. This is my first year as chair of the Patient Care Committee for the American Glaucoma Society. And they've done a lot of work, as well as many other societies, looking at sustainability, reducing costs, optimizing patient safety. And so they've been very supportive about this position statement. And basically, it's a position statement with the American Academy of Ophthalmology, and it is pending. So the American of Ophthalmology group has worked with us, their leadership group, and it's been an amazing experience. And in the next couple of weeks, we're hoping to hear back from the Board of Trustees of the American Academy of Ophthalmology with their decision regarding the position statement. And basically, it's a position statement that says we really ask to reclassify, we recommend to reclassify tonometer tip disinfection to low-level disinfection, which will allow alcohol wipes to be used. And it would reclassify the tonometer tips from a semi-critical instrument to a low or a non-critical instrument requiring low-level disinfection. And that's a huge change with all the benefits that we've talked about for patient safety, as well as sustainability, cost, and so on. If a patient has an obvious sign of an infection, ocular trauma, certainly there are other options for disposable tips or eye care or TonoPen or other very good options for tonometry in those situations. But I think the main thrust of the paper is to reclassify tonometer tips from semi-critical to non-critical instruments requiring low-level disinfection.
So when that comes out, I'm assuming that it gives permission to academic institutions and also people in private practice to start using the isopropyl alcohol wipes.
I wish that were the case, but it's not the case.
Okay, and so, educate us.
So even
what comes next?
So the position statement is a great start, and really, the AGS has done a phenomenal job leading the way, as well as the AAO. But there's other incredible groups like iSustain, OOS, ASCRS, and so many leaders across the country that have been champions of sustainability. And I think it will really take continued efforts to change the manufacturer's IFU, which is instructions for use, approach the CDC, approach the FDA, approach Joint Commission. And so we have a lot of teams across the country that are really poised to take those next steps. But I think this position statement from multiple societies, I'm hoping that it goes through. We've revised it several times. I'm hoping that it's successful because I think it would be the first step in many subsequent steps that are needed before we change the protocols officially and are allowed to use alcohol wipes to clean the tonometer tips. So, yeah.
You brought up other organizations and champions around the country for these efforts. What resources are out there for physicians evaluating whether a drape, like they realize the drape they're using for an office procedure or a glaucoma procedure in the operating room may be a lot bigger and more robust than what they need, or maybe they've seen videos from other locations with drapes that are different than theirs. You mentioned multi-use drops, after surgery or in clinic. But what resources are out there, or what opportunities are out there for people to engage, volunteer, be informed, or have a conversation about this? Whether through, you mentioned iSustain, but through the Academy, where should people turn if they want to investigate this topic more?
That's a great question. So I think it starts local. So I think really talk to your sustainability champions within your institution. talk to the people that you work with every day, and really brainstorm. You know, the drapes, about 40% of the world now uses short drapes for ophthalmic surgery, and that's a really simple but exciting opportunity. So look at what other institutions, other countries are using, so look locally, but then look at other institutions, and really look globally at what efforts are underway. I think reaching out to your societies is another great way to collaborate, to understand what other people are working on. And I've really enjoyed doing that with different societies now. And I think we make more progress working together. So that's exciting. So I think, if you go on the iSustain website, there's 7 steps, I believe, that they list on things that every ophthalmologist should know and can do to improve sustainability in their workplace. So I think that's another great place. Go online and look at what that wonderful organization has to say.
Wonderful.
Yeah. My last question is just regarding your next step. So congratulations on your new role with the AGS. And I'm just wanting to know a little bit more about the committees that you'll be leading and maybe some next efforts. What are you excited about, some next projects?
So I think sustainability is never ending. And so I'll continue my efforts here at Mayo, working with my colleagues to enhance sustainability, reduce costs. AGS, I'm really happy to work with different subcommittees that are part of the Patient Care Committee. And so we'll work with legislators, we'll work with societies to really spread the word about sustainability, and so that it's more of a global effort. I think that just spreading the word and working with different societies is really the next step.
Thank you.
Well, thank you for sharing
Absolutely.
Your expertise, your history, your research, just your wisdom on this topic, and your encouragement for all of us to be engaged and informed and make change. It's one step at a time.
Yeah, thank you. We look forward to seeing this in print as a statement in a few weeks.
Thank you.
Yeah.
I appreciate you having me.
You can find all episodes of the Mayo Clinic Ophthalmology Podcast on our website, YouTube, or on most podcast platforms.
Thank you for listening, and we definitely look forward to sharing more on our next podcast.